Moving to Ethiopia now, where despite an end to the conflict between the government forces and the Tigrayan rebels in the north, many hospitals and clinics are finding it difficult to recover from the ravages of war. The conflict, which took place between 2020 and 2022, led to several healthcare facilities being targeted in Tigray. These facilities are now short on resources and funds to cater to the population. The government is also not in a position to disperse more funds due to its tight finances. Our next report gets you all the details.
In the northernmost region of Tigray in Ethiopia, several hospitals are struggling to recover from the ravages of war. The conflict between Ethiopian government forces and Tigrayan rebels that raged from 2020 to 2022 saw many hospitals and clinics being targeted and several doctors being killed. Despite a peace deal 2 years ago that stopped the fighting, hospitals in the northern Tigray town of Shiraro remain desperately short of resources. At one such hospital, the Mayani Hospital, Kiros Girma, a 60-year-old ex-soldier, looks at his dirty bedsheets despairingly. Suffering from shortness of breath, he wonders how he could ever be cured in a place like this.
Because it's been destroyed by the past war, we're not receiving enough health services. We can't receive enough equipment.
The hospital suffers from shortages of medicine and equipment. It estimates that per year it would need 100 million birr to cater to the population. However, the government is providing only 4 million birr at the moment, which has not been enough to meet needs. But was the situation the same before the war broke out in Tigray? No, it was not. Prior to the war in 2020, Tigray had relatively better healthcare systems in Ethiopia. The state had over 720 health posts, 224 health centers, 24 primary hospitals, 14 general hospitals, 2 specialized hospitals, 250 ambulances, and more than 20,000 healthcare workers. Tigray also had over 90% of accessible public and private health facilities before the war. However, after the war, the situation has completely changed. The war displaced more than 1 million people from their homes, according to the United Nations. Many of these displaced people are now crowded into camps, fueling the spread of cholera and polio. And the healthcare sector has been under immense pressure.
Around 89% of the health facilities were damaged during the war. 99% of medical equipments were either looted or they were damaged. And they are still in a space where they've barely been able to recover like 33% of health facilities.
With shortages of medicines being a common factor across hospitals in Tigray, many patients have had to buy essential medicines for treatment at higher prices. For Zameda Teklai, a 28-year-old patient being treated for bowel cancer at the Eider Hospital in Tigray's capital city of Mekele, there are no available medicines for her treatment at the hospital. She has had to procure them at inflated prices from outside.
I don't have money to buy medicines. Up until now, I was getting medicines with whatever I could sell. I don't have anything now. I have finished what I had. We're buying from outside from 7,000 to 8,000 birr for one medicine.
However, from the hospital's perspective, getting medicines has been an even bigger problem due to the non-availability of suppliers in the market.
Whenever we are ordered with some medications, we have to get it from outside. Like I said, there is no available reagents or supplies in the market like we want. But even if there are, like I told you, we don't have any money, we don't have any budget to purchase from the market and supply it to the communities.
Yet funds are far from being dispersed by the government, whose finances are already tight. This has killed hopes for improvement in the situation in Tigray, whose overall reconstruction costs are estimated at more than $20 billion.